Good evening, everyone. My name is Leslie Rattan. Welcome back, or welcome to the Canadian Concussion Center's webinar series, which is sponsored by LiUNA, which is the Laborers International Union of North America. And for those of you that have been here, you'll know that in this series, it's been developed for people that are struggling with symptoms, persistent symptoms of concussion, for healthcare providers, for families of those with concussion. And our sessions to date have generally, you'll know that we have expert speakers for the first half of our session, and then that is followed by a question and answer segment. And the sessions recur every other week on Tuesday evenings. We've got, I think, a couple more left. Tonight is actually our 24th session. And if you've missed any of the previous ones, you can actually go to the Canadian Concussion Center website, which has recently just been updated, and you can find all of the recordings there on the various topics. So just for the purposes of this evening, if you haven't been here before, if you look towards the bottom of your screen in the Zoom application, there's a Q&A at the far right. So if you have any questions this evening, please enter the questions there and to get those answered later. If you're having any technical difficulties, just enter those into the chat box and someone will get to you to help you out. We're just going to run a short poll, which Christian is going to put up, and this is just to help us understand who our audience is. So if you can just indicate in the poll and then close that up. So this evening, I'm really pleased to have Dr. Carmela Tartaglia, who is back with us. And Dr. Tartaglia is an associate professor at the University of Toronto and a cognitive behavioral neurologist at the UHN Memory Clinic, where she sees patients with neurodegenerative diseases and persistent symptoms of concussion. She's a scientist at the TANS Center for Research in Neurodegenerative Diseases, where she uses a multimodal approach for biomarker discovery to facilitate early detection of neurodegenerative diseases and diagnosis of persistent symptoms of concussion. The ultimate goal of her research programs is to develop biomarkers for early detection of disease so as to provide targeted, personalized treatments to her patients. She also holds the Marion and Gerald Soloway Chair in Brain Injury and Concussion Research. And with that, I'm going to turn it over to Dr. Tartaglia for tonight's presentation.
Muted. Okay, so thank you, Leslie, for that lovely introduction, and hello to everybody. So tonight I'm just going to go over some myths and about concussion, as well as some non-evidence-based therapies. Unfortunately, concussion has become very, very popular with respect to practitioners and to cure-alls. And unfortunately, there's been a lot of misinformation related to concussion and ways to recover from concussion, which leaves me with many, many patients who have expended a lot of energy as well as money, but still needing help. And so we're just going to go over what, some of the things that we know about concussion and some of the things that aren't really based on fact. So let me move forward. So basically we'll go over the myths and fact in concussion as it relates to diagnosis, some treatments, as well as to long-term consequences. And so the first one is you have to lose consciousness to have a concussion. That is a myth. Most concussions do not result in a loss of consciousness. Actually, less than 10% do. Brief loss of consciousness can occur in concussion, but it usually is less than 5 minutes. Some of the old definitions say less than 30 minutes, but I have to say anybody I know that has lost consciousness has really been very, very brief. Some people can't remember events, so they have an amnesia, which means they can't remember before the concussion, what happened just before, or about the event itself, whether it's a motor vehicle accident, the actual hit or the actual fall, and sometimes even the period afterwards. So, and that can last usually less than 4 hours, and we call it post-traumatic amnesia. And some people feel dazed, confused, but they haven't lost consciousness, but obviously have had, a significant head injury. The second myth, direct relationship between the presence and duration of loss of consciousness and concussion severity. Actually, that is true and not true. So if somebody has prolonged loss of consciousness, okay, I'm talking longer than 5 minutes, longer than half an hour, the old definition, well, then you're worried about a different kind of injury, because that would be very, very unusual in a concussion. But in a concussion, a brief loss of consciousness does not necessarily correlate with concussion severity. So you could have no loss of consciousness and still have a concussion. And, the symptoms of concussion can still be prolonged even if you didn't have any loss of consciousness. The third myth, concussions only result from a direct blow to the head. That is not true. A concussion can be sustained from a hit to the head, but as well, a sudden violent movement of the head that's caused by an external force to the body. So something like a whiplash injury, just having your head move back and forth, over your neck can be enough, could be associated with enough force to actually end up with a concussion and concussion symptoms. The same forces that cause the whiplash injury of the neck can cause the concussion of the brain. Another myth is a concussion is not a brain injury. I really laugh at this one because, when people think about the concussion symptoms like headache or dizziness or vision problems or, mood problems, when there's persisting symptoms, poor sleep, all these symptoms come from the brain. So of course, we think the concussion results because there's been some alteration to the brain. It's also been called a mild traumatic brain injury. And like I said, the signs and symptoms of concussion are really the result of an alteration in the brain, though short-lived, but it's still because of a change in the brain. How about sports-related concussion impacts can't be compared to motor vehicle accidents or other causes of concussion, whether it's a fall? That is not true. Sports-related concussion studies have indicated that concussions from many mechanisms of injury are comparable. So it's more because of the type of injury than the actual mechanism of injury. All concussions are the same? Well, we know that's not true because, if 10 people who've had concussions, then 10 different post-concussion outcomes. There's many variables that influence the outcome. So sex and gender, so being male, female, impacts can have an influence on the outcome. Number of previous concussions, your age, other medical, psychological problems, stressors, all this will affect the outcome of a concussion. So it's to be expected there's going to be variability in outcome, which includes the symptoms of concussion as well as the length of recovery. And there are certain patterns that we see. And so that's why, when we prescribe certain treatments, it's based on these patterns. There's commonalities across concussions in terms of the way we treat symptoms, the kinds of symptoms, but there's so much variability in people that it's not, unthinkable that there's going to be a lot of differences in the outcome after concussion. But luckily, most people get better. Unfortunately, at very, very different rates. And so sometimes people get better within hours, days, weeks, months, and sometimes it takes people years to get better. But we expect most people to make a full recovery after concussion. Injury to brain occurs only at the initial impact of the concussion. So we know that concussion is an evolving process, like anything else, right? There can be the initial injury, but obviously then there is a reaction to the injury. And so, over the next hours, days, weeks, and months after the impact, there are changes in the brain that can occur. And so that's why it's actually very, very important to protect yourself against another concussion while the brain is still trying to heal from the first concussion. And this is one of the reasons that we usually suggest that people, in a sport that is at risk of causing another concussion, stop playing that sport until they actually completely recover. Now, let's talk about diagnosis. There are a lot of myths about how you can diagnose. There's, this idea of a Spect Scan, which is supposedly useful for diagnosis of concussion. A Spect Scan looks at the perfusion of the brain, and many different things change the perfusion of the brain. So a Spect Scan of somebody with concussion looks pretty similar to one who is suffering from depression, who's suffering from lack of sleep, who's suffering from who's taking certain medications, and even in some cases, degenerative disease. So a SPECT cannot be used to diagnose concussion. It can tell you there's some alteration there, but it cannot tell you what the cause of the alteration is. And since there's so many different causes, it's not useful today. That doesn't mean that, a good study won't be done in the future, which will definitively say it can be used and can be used with this type of severity and this type of person, just like other tests have been done. But the problem is that right now it hasn't been used for that. And EEG and those, so this is for people who don't know, it's a type of test we use to detect seizures. Okay, and so some people have been using it as part of biofeedback mechanisms, saying that, you can use this to detect concussion. You basically can read brain waves with an EEG, okay? This is not able to detect concussion right now. There's even the most sophisticated form of this is not able to. Oftentimes, these tests are very costly. They are used in all kinds of things. And a similar pattern gets a very different diagnosis depending on what you have. So it's quite interesting to me because I had a patient who ended up paying for one of these. And this person had a degenerative process, a very rare, actually, condition. And the pattern that was seen there was similar to somebody had brought in on an EEG that in this person, the other person was concussed, and completely different reading for the exact same data. So, you really want to be wary of this. These tests are not able to tell you that you've had a concussion. Even one test a few years ago got labeled as a concussion test because the FDA, so the Federal Drug Administration of the United States, said this was a concussion test. Actually, the test had no data that it could be used for concussion. The test is actually for anything more severe than a concussion. And, it basically picks up something that spills in the brain when you have a severe brain injury. And is not being used, actually, is not even part of studies really anymore. So I really think you want to be really critical of this. If something is an established test, like you probably have had blood tests for, to check your thyroid function or your hemoglobin, those are established tests. You go to a lab, there are certain ranges. We have a normal range that has a lower limit, a higher limit. It's been tested against, across different populations. Those are tests. These are, some of them are research tools and very interesting research tools, and one day may be useful for something, but today they are not accepted as tests. Today, a clinical assessment, which your medical doctors do, is the only way to diagnose a concussion. An MRI or a CT scan can be used to rule out a more significant brain injury. So this is established. An MRI or a CT scan cannot pick up that you've had a concussion, but they can rule out that you've had something more severe. There's a lot of research being done in this area. This is this is a very active area. And so I am optimistic that, you know, hopefully in the not too distant future, there will be something. But as of today, there are no tests for concussion. You need to see your physician and you need to tell them your history, and the physician, based on that, will tell you whether you've had a concussion or not. And how about this one? Male and females, whether they're athletes, employees, motor vehicle accident victims, have the same chance of sustaining a concussion. Actually, that is not true. Females seem to have a higher risk of suffering concussion, and this has been reported in sports as well as motor vehicle accidents. The cause is actually unknown. Certain possible culprits have been proposed, and one is hormones. Obviously, female and male hormones are quite different. Neck muscles. Many females have smaller neck musculature, and so the thinking is that the forces that the brain sustains because of these smaller neck muscles is greater. So, you know, when you think of like a whiplash injury or any hit to the head, it's just because the neck is less solid, there's much more give onto the brain. And, you know, there are also some people who propose that women are just more likely to report. We don't actually know what the reason is, but the fact is that women are at higher risk of suffering a concussion, and this has been shown with the same type of sports, the same kinds of injury. Now this one, athletes will acknowledge when they have a concussion, okay? This is a myth. And athletes want to play, so they really need to be educated on the consequences of playing with a concussion. Concussion usually is, you know, concussion is considered a mild brain injury. But I've said this injury is not just the initial injury. It can set up a cascade of changes that occur. And this cascade actually can result in a very significant injury to the brain if you sustain a second or third concussion during that time. So I'm not sure if you guys are aware, but there's a concussion law in Ontario. It's called Rowan's Law. And this law came about because Rowan Stringer died because of what we call second impact syndrome. So this person had 3 concussions over 5 days, and her brain suffered massive amounts of swelling, and she ended up dying. And because her parents, you know, were really adamant that this not happen again, they really advocated for concussion legislation in Ontario, and so now we have a concussion law here. It's called Rowan's Law. Now, second impact syndrome is very, very rare, but you know, probably you all agree that even one case is too many. But secondly, even if the second impact syndrome is very rare, suffering a concussion while you're trying to heal from the previous one does put you at risk of more prolonged symptoms. The other one, a player that gets dinged, bell rung, had their bell rung, or sees stars hasn't suffered a concussion. So that is not true, okay? Those terms are older terms when people didn't recognize what a concussion was, but they are a concussion. You know, when you think about what the feeling that goes with those kind of phrases are really related to changes in the brain and alteration in the brain. So, you know, when you think about the extreme is like, you know, seeing stars. Why would you be seeing stars? You know, that's a brain change that has occurred that has you seeing stars. You know, when people talk about their bell rung, it's because they, you know, they feel a bit dazed and sometimes get like loud, like tinnitus. So this ringing in the ear, you know, when you're feeling dinged, you know, that's usually a confusion or brain fog. So Of course, all those symptoms relate to the brain, and so they are equivalent to a concussion, and that means that you're at risk of a second impact syndrome and you are at risk of prolonged symptoms. And so any stunned confusional state is considered a concussion, even if symptoms may only seem to last for a very few seconds even. And the symptoms of concussion can become apparent only later. You think about an athlete, or, when you played, you're excited, you have this adrenaline rush. So sometimes the symptoms are quite delayed. And what you want is that, and also to note that these delayed onset of symptoms are actually more common in players who are less than 18. So it's essential that any player who has any confusional symptoms be removed from play and reassess them within a few hours. How about helmets and equipment will prevent concussion? That is not true. They will protect you against a more serious injury, which obviously is very, very important. So helmets do protect against moderate to severe traumatic brain injury, but unfortunately do not protect against concussion. And it does not matter how expensive they are. As well, there are no devices to protect against concussion. We hear about a lot of, media around some new devices that have come out, but to date, we have no significant evidence that these devices protect against concussion. We do know some things that protect. Some sports have actually changed the rules of their game to protect against concussion, and we know that works, but there are no devices to date that protect against concussion. And, I often hear patients tell me, well, it was, it's the federal drug agency has approved it. Health Canada has approved it. They approve things that aren't going to kill you. So that has nothing to do with efficacy, right? So the thing is that any device, or most devices, if they call themselves a medical device, they have to go get a license to be able to even, try to sell it to you. And so the Health Canada, they will prove to Health Canada that the device doesn't kill you. But they don't have to prove to Health Canada that the device works to do anything for you. And this is the same for, many things, right? If they're not considered a drug, it's much easier to get Health Canada approval, but it doesn't tell you anything about the efficacy of that device. Signs and symptoms of concussion are always apparent immediately after injury. That is not true. Sometimes the symptoms can appear a few days later, but usually within 7 days. We do not expect some concussion symptoms to appear weeks to months later. But you have to remember, when people have had concussions, especially if they've had it from a motor vehicle accident or some traumatic event, they can be in shock. Sometimes people suffer other bodily injuries, and the pain. So I always tell people, sometimes the way we react is we put out the fire and then we look for the water damage. But it's sometimes not apparent the first day or first 2 or 3 days, the extent of the problem, but usually within 7 days, people notice what problems they've had after the concussion. Of course, mental health issues can appear or worsen later, and that can be due to the effect of the prolonged symptoms like headache and dizziness. So you can imagine if somebody has post-traumatic headache and it's lasting weeks and months and not getting better, that somebody might become quite depressed about that, quite anxious, and that doesn't appear usually within the first few days. What about recovery? I've already told you that males and females don't sustain concussions at the same rate, but do they recover at the same rate? No, unfortunately, females are more prone to persisting symptoms of concussion, slower recovery. We do think that this could be related to hormones, not definitively. The evidence really comes from the fact that if you look at girls before they get their period and after menopause, they have very similar rates to males. Unfortunately, this hasn't, been proven in all studies, but the general thinking right now is that it might relate to the hormones. But it could also be that they've sustained greater forces due to less developed neck muscles. So this is difficult, right? Like we can't actually measure what's going on at the brain level when the concussion occurs. So it's hard to know whether, you know, when we see the same type of injury, whether the brain has actually suffered the same amount of force to it. This is the myth I really get annoyed about, because still today I hear that poor patients have been told to rest after a concussion. You know, the rest is maximum 48 hours. You know, we really want people to rest only that first day, 48 hours maximum. And afterwards, we don't want them to return to the activity where the concussion occurred, if it, you know, they're at high risk of subsequent concussion, but we don't want them to rest anymore, because the evidence is actually for the opposite. The evidence is that aerobic exercise speeds up recovery from concussion. And so we want people to start, you know, any protocol that helps them get active. So of course, you know, you want to start with a small amount. And so, you know, I usually tell people, you know, sit on a stationary bike for 5 minutes, right? And see how you feel. Low level of symptoms are not harmful. We obviously don't want you to, you know, go run a marathon or do something that puts you in bed for the next 2 weeks, but the evidence for aerobic exercise is overwhelming. There's evidence that aerobic exercise is good for the brain. It's good for neurons, the main cells of the brain. A study came out this week that it's great for the supporting cells of the brain, actually causes increased activity in them and, you know, helps their regeneration. So, you know, we want people to engage in aerobic exercise and, you know, to start as low as they have to, but really to get moving. Can't sleep after concussion, but it's not a factor in my other post-concussion symptoms. Actually, that is a complete myth. Sleep changes are very common after a concussion, and they affect everything, and it affects everything. So poor sleep is a very important factor in cognitive function, mood problems. So, you know, the issue is that even people who haven't suffered a concussion, you can have concentration problems after, you know, if you don't sleep well. You can have memory problems. Obstructive sleep apnea is a common finding in those with persisting symptoms that have gained some weight and snore. And sleep apnea is actually a very serious condition that harms the brain and so needs to be treated. And sleep apnea basically is saying that your brain doesn't sleep all night long. So of course, you're going to have poor memory and thinking and concentration. And it can worsen your headaches. So it's important to, you know, treat any sleep problems and to actually get them evaluated. Depression and anxiety that happen after a concussion shouldn't be treated as they aren't the main problem. That is a complete myth. Depression and anxiety, when untreated, interfere with recovery. So they impair your cognitive function. They give you a poor memory. They give you poor concentration. They impair your sleep, which makes your memory and thinking and concentration even worse. So they absolutely have to be treated after a concussion. It's imperative to recovery, to have depression and anxiety treated. Another myth that I hear, and I'm not even sure where this comes from, antidepressants are addictive. Antidepressants are not addictive. Most of them, we don't even have to taper people off, but some of them we do. But like all kinds of medications are like that. We usually start very low. We usually go up to, and we actually can use in many times low amounts, but they're not addictive. And if one doesn't work, there are different ones to try. Of course, we're all different and different medications work for different people. There's many different antidepressants. And if one doesn't work, we can stop it. We can try something else. And when you've recovered, most of my patients come off of them because they didn't have a primary depression before the concussion. Their post-traumatic depression resolves with treatment, and then they go back to their baseline. So, you know, by treating the depression and the low mood and the anxiety, we actually improve cognitive function. Probably that's what helps them get back to work, get back to their lives, and, you know, also helps them feel better. cannabis, CBD oil, THC, any combination is helping my anxiety, helping me sleep. So the problem is that those are not established treatments for mood disorders. They're not established treatments for sleep disturbance after a concussion. They actually are addictive, and they can affect cognitive function. Even in the few studies where people have used cannabis, like in multiple sclerosis and in HIV, in multiple sclerosis, it was used for pain. In HIV, there are some studies for anorexia, if you lose your appetite. Did work. There was a cognitive cost. So, I really urge people who are having cognitive complaints, especially, to stay away from using these agents. It's not to say that one day there will not be proof that something helps one thing and gives you side effects, for sure. But you should use a critical approach and, look to the scientific literature. When you are given a blood pressure medication for your blood pressure, that medication has undergone study. Millions of dollars have been spent to study it. It's been, Health Canada approved that it's safe. It actually does what it says it's supposed to do. That hasn't happened in cannabis, in the cannabis world. So I really urge people to take a critical approach to these campaigns, because they're very powerful. Actually, I see cannabis shops all over the place and propaganda. And, I always say to people, if it's too good to be true, like cannabis can cure everything, it can cure dementia and autism and psychiatric disease and sleep. Well, probably not true. Unfortunately, one thing that actually has good evidence is that cannabis, CBD oil, THC, have been associated with psychosis and low mood. So they can actually exacerbate depression, as well as in some cases cause psychosis. How about this one? It's okay to take Tylenol, ibuprofen when I get a headache, which means, people are taking it every day. You shouldn't treat headache from concussion with medications, as you may mask symptoms. These are both myths. It's not okay to take Tylenol, ibuprofen every day. Headaches need to be treated. And if you take Tylenol, ibuprofen, and all such analgesics for more than 14 days per month, you actually are giving yourself a medication overuse headache. And unfortunately, those are really tough to treat. So it is important, though, if you have headaches every day, and I don't mean head pain only, I mean, if you feel your head, you shouldn't be feeling your head. Most of us don't feel our head. And probably if you think back to before your concussion, you didn't feel your head. So if you feel your head and it's going on for most days of the week, then it's going to affect your cognitive function, because it's basically taking a part of your brain concentration, part of your brain's bandwidth, to focus on this headache, this head pain, head pressure, head feeling, whatever you want to call it, instead of actually doing what it's supposed to be doing. And your brain's supposed to be paying attention to what you're supposed to remember or what you're supposed to be doing, instead of, focusing on your head. So I really urge people who have multiple headache days per week, who are suffering from constant head pressures or head, feeling, to start taking something to prevent the headache. And usually these headache prevention medications are taken for a few months, and that help resolve the headaches, and then people can stop them and go back to their pre-concussion state. How about this one? I have visual symptoms, blurred vision, pain, dizziness, and I was prescribed vision therapy, as it is supposed to help. Well, there are many types of visual symptoms after a concussion. Some people can complain of double vision, blurred vision, avoidance of near tasks, so they can't look near, reading difficulties, illusory motion, so people seem to think things last on the, last as they're moving their eyes, sensitivity to visual motion, they can't tolerate complex environments, sensitivity to light, computer screen intolerance. But unfortunately, there is no evidence that vision therapy helps these post-concussion visual symptoms. There is evidence that vision therapy does help certain childhood diseases like strabismus and other ones, but not for concussion visual symptoms. So, I think it's really important to think about that. I've had some patients tell me, yes, I think I got some visual therapy and I did, X number of sessions and I feel better. And I always ask them, then why are you in my clinic? Why are you still here? Like, aren't you better? Because you're still complaining about visual symptoms. Some people have headaches. And so, of course, they're going to have sensitivity to light and have trouble with seeing, because that actually is part of a headache phenomenon. If you have a headache, you actually are going to have trouble looking at a computer screen all day. So some of the symptoms that people ascribe to visual problems are actually partially headache problems. And when their headaches get better, their visual symptoms go away. I was told that biofeedback, neurofeedback, concussion lab, laser, headlamp, hyperbaric oxygen, cranial sacral therapy are going to help my recovery. This list is so long, I couldn't possibly put them all here, but unfortunately, none of these therapies have evidence that they are helpful are useful for helping recovery from concussion. And to date, we don't have any methods except for actually targeting the individual symptoms. So, the aerobic exercise has the best evidence, and it keeps, it keeps getting validated. It's confirmed in the literature. But all these other therapies that have actually spent a lot more money in advertising them than actually studying them don't really have that kind of evidence that we need to prescribe something for somebody to recover more quickly from a concussion. We do have evidence, though, that a lot of the post-concussion symptoms improve with treatment. So we can improve post-concussion depression. We can improve post-concussion headache. We can improve post-concussion sleep. And helping these symptoms actually helps recovery. So there's lots of good methods for dealing with these issues, and we should be targeting them, and we should be treating them. But unfortunately, there's no easy fix. There is evidence for physiotherapy, occupational therapy, vestibular rehab, that yes, these can help some post-concussion symptoms. Again, targeted therapy for what you need. Cognitive behavioral therapy, psychotherapy as well has good evidence that it can help a lot of the post-concussion psychological symptoms. I cannot return to work as I am not back of baseline. My lawyer has said that I need such and such therapy. So these myths are really related to, returning to work and getting yourself back on track to your life. So, I hear this, that some lawyers are prescribing therapy in the sense of they're not prescribing the therapy, but they're making suggestions about what people need. And they aren't medical practitioners and shouldn't be prescribing therapy. And as a patient, you should know that, because you hopefully would not want legal advice from me because I'm not a lawyer. And so, I think the same holds true. You wouldn't bring your car to your plumber. Doesn't matter how great your plumber is. We should be working within the scope of our practice, okay? As well, we hear that people can't return to work because they're not back at their baseline, but actually returning to work is associated with better recovery. So every attempt should be made to make a graduated return to work. And so, we'd like the patients to work with their employers as much as possible. If there's an occupational therapist on board that can help, you don't have to be back at 100% to return to work. It's okay to return to work with accommodations. So I always tell people, the longer you stay off work, the harder it's going to be, because it's like, let's say you were an athlete, but then you broke your leg and you were, sitting around for like, 2, 3, 4, 5, 6 months, and your leg healed, but then you went to run a marathon. Well, you wouldn't feel very well. Actually, you probably wouldn't succeed. You'd fail. You might actually hurt yourself. So we want people to do graduated returns, and sometimes they can't at their workplace because of the nature of their job. So then I tell people, it's like, well, volunteer, but start putting some structure into your day so that when you have to go back to work and you need to concentrate for, extended periods of time, which, most of us do at work, have to concentrate the whole day, then, you're not coming back from a nice, long vacation where, think back when you were a student and you came back from your summer holiday and the first week of school was like, oh, wow, I have to pay attention all day. I have to sit in class. And, you need to think of your brain in terms of like conditioning it to return to work. And speak to your employer, your medical practitioners, and try to, set up a plan. Occupational therapists can be very helpful. So, if there's a way to have access to them, I think they can be quite helpful for people. And how about there are no long-term effects of concussion? Well, if symptoms of a concussion aren't treated, then they can result in more prolonged symptoms that affect your cognitive function. So memory, concentration, physical, ongoing headache, and emotional, depression, anxiety, post-traumatic stress disorder. And this can go on for months and years. And it's very surprising to me sometimes to see people who, have refused to take any medication and aren't willing to really try many things. And they've been at it for 2 years, still expecting their concussion symptoms to improve. Well, I think, we have to be smart about it. And at a certain point, you can say, yes, I would like to see what the natural history is and how I'm going to recover over the next few weeks. But after a few weeks, if you haven't gotten better, you should start to think about treating the various symptoms that are still persisting and, trying to get back to your regular life. Again, with these no long-term effects of concussion, well, we do have concern for long-term. I think in 2020, mild traumatic brain injury joined the ranks of modifiable risk factors for some of the neurodegenerative diseases. The one people worry about most is this chronic traumatic encephalopathy, which has been described in a few boxers and football and hockey players. But as well, it has been implicated in Parkinson's disease, Alzheimer's, even ALS, frontotemporal dementia. So, what is the relationship between concussion and these degenerative diseases? Well, it's not one-to-one, because we know people who've had multiple concussions who don't have any of these conditions, and there are, almost 100. And we know people who have never had a concussion and have some of these conditions like Parkinson's, Alzheimer's, ALS. So far, we don't have anybody who's had no concussion and has chronic traumatic encephalopathy. We do think multiple concussions is the risk factor for that. So, this is more of a warning to protect your brain. We know, not all smokers get lung cancer, but I hope you would realize that smoking does increase your risk and that you would try to avoid getting concussions. Now, obviously we can't help, sometimes, right? You have a motor vehicle accident, you slip and fall, you can get hurt, playing a game, and we want people to be active, but to just be mindful that it has been associated with some of these degenerative diseases. And at the same time, to think about, well, you should be doing everything to protect your brain health, because if you've done, you've put something in the bad basket, a concussion, well, you really want to be quite vigorous in your filling of the good basket, which means things like doing aerobic exercise, lifelong learning, good sleep, avoiding things like alcohol and cannabis and these things that could be toxic to the brain, the eating properly, all the things that we know actually are good for your brain, making sure your blood pressure is well controlled and your sugars are well controlled, those kinds of things. And, the evidence is actually much more solid for moderate to severe traumatic brain injury. And the biology of the relationship is unknown. So I usually think, all these things can happen after a concussion, but we want to think of the brain as these gears that you know, kind of are intertwined. And, you know, sometimes when you treat one thing, it actually gets all the gears going. So we really want to use targeted therapy for whether it's headache or sleep or mood, because that can definitely help your cognitive function. So to summarize, there are many myths that are circulating about diagnosis and therapies and persisting symptoms, but you want to be really critical about the information you receive. There's lots of research being done in concussion. Every day we learn new things, so stay on top of it. There's very reliable brain injury association websites. There's hospitals, universities. I put some resources at the end. And, you know, there are many treatments related to concussion and that are really targeting some of the main symptoms, and they do improve outcome. Lots of evidence for aerobic exercise and lots of evidence that returning to work, school is good for recovery. So you need to work towards that as soon as possible. And these are some of the resources. And I will stop sharing.
Great. Thanks so much. That was excellent. I am just wary of the time and I'm looking, we've got a number of questions, so I'm going to jump right in. Okay. Maria asked, what are the specific signs and symptoms that a physician needs to identify to diagnose a TBI, presumably a concussion? There seems to be quite a spectrum of skill in this field.
Yeah, so that's a great question. We usually go with, you know, you've had some injury, okay? So something that actually has jostled the head or hit the head, and then you develop symptoms. So, you know, there's a long list of symptoms, but, you know, the typical ones are, is there a headache, dizziness, tinnitus, like ear ringing, unsteadiness, brain fog. So those kinds of symptoms are the ones that we really think of are related to concussion. And with those, we usually say, yes, you know, you've had a concussion. Yeah.
Great, thank you. Edwina says, Sarah Pauly's recent book, Run Toward the Danger, was titled after the treatment advice she received in the US for a concussion she sustained. Is the type of treatment she received, which was exertion, exposure, etc., a viable form of treatment? If so, why don't Canadian doctors recommend the same type of treatment?
Yeah, I actually don't know what that treatment is. I mean, I'm hoping exertion means, you know, if I interpret it properly, it means exertion, exercise, and exposure. You know, try returning to work as quickly as possible, returning to school. But I don't know. I haven't.
Yeah, I haven't actually read her book yet, so I'm not sure. Rachel comments, I contacted my family doctor when my concussion symptoms persisted a month after injury. He recommended complete rest. Fortunately, I was in touch with a local concussion clinic who told me it was outdated advice. This year, I sustained another one. Once again, went to my family doctor who suggested complete rest again when I expressed concussion-related symptoms a couple of weeks after. And so she's then asking, how can I educate my doctor on current concussion research? So he stops recommending complete rest.
I know we still hear this, and you know, I mean, the Ontario Neurotrauma Foundation, their guidelines are actually available. It's on my resource page on my slides. Yeah, I'm so sorry that's happened, and I hear that a lot. But maybe the Ontario Neurotrauma, there's the brain injury guidelines, I think, the website. So maybe, I don't know, if somebody could post that somewhere.
Yeah, maybe Christian can post that, but yeah, that sounds like a great suggestion. Edwina's asking, is it a myth that persistent concussion symptoms that last over 3 years are permanent? What types of treatments work for one experiencing symptoms for so long, for example, headaches?
Yeah, I think, you know, that's just based on some data where we had data that showed that people who'd had their concussion symptoms for 3 years still hadn't recovered. I did have a patient actually who had concussion symptoms for 10 years, but the patient's symptoms actually had not been treated. And once her mood was treated, her headache got treated, she actually went back to work. So it really depends, you know, is it like treatment failures, or is it that, you know, not enough treatments have been tried? You know, maybe it's, hopefully you've seen a headache specialist if you're still struggling with headaches after 3 years. some people do have, chronic headaches even before concussion. And so they can sometimes be very difficult to treat, but there are new treatments that have come on the market in the last 2 years. So, hopefully get back in to see a headache specialist.
Yeah, for sure. Thank you. How long can patients be on preventative meds for headaches? You mentioned a few months and then they can come off of them. I've been on them for 5 years now and wonder if that's too long.
So that isn't too long. So people who have primary headache problems, they are on them for life, right? And some patients do need them, for longer periods of time. I always suggest to my patients who have developed post-traumatic headaches to try to come down and see what happens. If their headaches come back, then they need them. If they don't, then that's okay.
Great.
Stop it. Yeah.
And on the headache front, what are your thoughts on the usefulness of B2 400 milligrams and coenzyme Q10 200 milligrams for concussion headache?
Yes, I use that cocktail with is there B2 and then I add magnesium to this also, magnesium 400, and honestly this comes from the headache world, right? It's not like we've tried it in post-traumatic headache, but in primary headache clinics, people use a lot of this cocktail, B2 400, magnesium 400, as well as coenzyme Q10 200. So, we use it. It works for some people and doesn't work for others. But
Right.
I think it's a good try, especially for people who don't want to try medications firsthand.
Sure. Thank you. Maria asked, does the decrease, just for those of you that are entering questions, if you can enter them into the Q&A as opposed to the chat. But Maria has asked, does the decrease in estrogen level in postmenopausal women with subsequent decreased cerebral blood flow contribute to slower recovery of brain healing? What is the role of estrogen replacement in TBI in this group?
Yeah, it's a good question, but we don't actually have any evidence for that. We don't have evidence for using estrogen. We don't have evidence to not use it. It's a good question and it's an active area of research.
Great. I have heard people promote EMDR. I'm assuming that is not evidence-based, nor does it make sense.
I actually do not know what those letters stand for.
So it's actually eye movement desensitization reprocessing, and it's my understanding, not for concussion, for there, I think there is some evidence for treating post-traumatic stress disorder. That's where it has sort of taken hold. I don't know, Carmela, if you have any more to say.
Yeah, I don't know about it, and I don't know it as a treatment for concussion.
Okay. Maureen asks, do you have an opinion on the BEARS therapy, brain enhance and recovery system? Starts with exercise, then a few hours of cognitive therapy based on the clock theory, and then I'm assuming meditation or mindfulness. It is several months long and quite expensive.
Okay, so that quite expensive part, I don't like it already. I like the exercise part. Great. I like cognitive behavioral therapy. There's tons of online resources for cognitive behavioral therapy right now that are free. Cognitive stimulation, important, does not need to be expensive. So yeah, I don't agree with the expensive part. The rest of it sounds good.
Okay. What about fish oils for recovery from concussion?
Yeah, no evidence.
Vestibular therapy exercises, particularly habituation exercises, seem very similar to vision therapy. Can you explain the difference?
Yeah, and they actually are, right? Because it's basically vestibular therapy. So after concussion, it is not uncommon for people to have inner ear problems. And so basically by doing some of these therapies, we retrain the brain to kind of reset that it's kind of, we call it a gain, like the difference between what you see and your head movement. So when you think about it, if you have a piece of paper in front of you and you're moving your head, you can actually focus. But if you move the paper, you can't see. So that is because your brain actually says, hey, your head is moving. We need to reset. Those exercises can work. Even people who've had strokes in certain areas, we can do rehab to fix that. But these are limited sessions, right? So it shouldn't be like 30, 40 sessions. The brain retrains itself relatively quickly. So, you could do that and see, you can try it yourself and see if that helps. In vestibular physiotherapy, they do that to help. And there is evidence for that. So I'm just not really sure on why it's so expensive to do
that. For alternative therapies, is the situation such that there is no evidence that they work because no studies have been done, or have studies been done that prove they don't work?
They actually have no studies, except that's the biggest problem. Nobody's even bothered to do some of the studies.
Mm-hmm. Yeah, that's a great question.
Mm.
What if you've tried many, many proven therapies for years to address TBI-induced headache, but constant headache persists?
Yeah, that's a great question. And I do see people like that, and I usually send them to the headache specialists. And like I said, there are some new treatments available. Of course, the first thing I do is always make sure there's not a sleep problem or a neck problem, like something else giving them headaches. But then if I fail, then I send them to the headache specialist.
I've seen helmets with MIPS technology, I'm not sure what that is, claiming to minimize concussions. Is there any evidence to support this claim?
No, there is no evidence for that.
I've been getting some cranial and frontal lobe, and I'm not sure what that one is, Qjong treatments for a month. Some of my head pressure seems to be lessening in pain. I don't know if you have any comment on.
Yeah, I don't really, because I don't really know what that is, but
okay.
Yeah.
I
saw somebody ask about cranial light laser therapy. There's no evidence for that.
Okay. Yeah, I'm just
none of the.
I'm trying to get in as many as I can.
I'm just looking too. Yeah.
I know. Thank you. What treatments are available to treat patients with dizziness and other visual symptoms?
Yeah, it really depends what the cause of it is. Is it related to an inner ear problem? Is it related to headache? Is it related to a visual, a vision problem? So the first thing is actually to figure out what's the cause of the problem. Because I'll tell you that a lot of times patients complain about vision problems, but actually it's related to headache. And when we fix their head pressure, but because they didn't have head pain, they feel like, no, I don't have a headache. But headache doesn't mean just head pain. If you feel your head, that's not right.
And someone is just asking, can you repeat your headache amounts for the B2, the coenzyme Q, and the magnesium?
So magnesium and the B2, both of them at 400 milligrams. And the coenzyme Q10 is about 200 milligrams.
Okay. And does it matter what type of magnesium?
No, I just say buy whatever's on sale. The thing is, like anything, even though these things are minerals and vitamins, you want to be careful when you're taking something, because, you can always have side effects. Like magnesium is actually, associated with diarrhea. So you want to be careful when you're taking that.
Right. And I'm assuming too, this person's also asking, are there any contraindications if they're taking something like gabapentin?
No, there's no contraindications to that. It would only be if you're, you have some allergy to something.
Okay. Shelley's asking what specialty a headache specialist is.
They're a neurologist who specializes in headache.
Great. Any thoughts about ear insufflation for headaches?
No.
Okay.
No thoughts, sorry.
I haven't heard of that one either, so I'm not sure. Okay. Okay. Maybe one more. So Michelle's saying, I'm 4.5 years out from my concussion. I still suffer from many symptoms, although I did a gradual return to work, see a psychologist for mental health, and take antidepressants. I still can't function. Is recovery possible?
Yeah, I mean, it's difficult for me to comment on somebody I've never met. I think it would have to be, you have to look at case by case, symptom by symptom, what's been tried, what's not been tried. Is there a combination of things that could be tried? If you've gone back to work and with accommodations, well, just a slower, or if you haven't gone with accommodations, or maybe a slower return to work can be more beneficial. It's difficult to comment when I haven't seen something myself.
Okay. I'm going to do one final one. Stacy indicates, and we're back on to the vision therapy. I'm in vision therapy with neurovision. In their assessment, they found 6 things wrong with my eyes brought on by a motor vehicle accident. They seem to know what they're doing, but you seem against the therapy. I've also heard from many in my concussion groups that they swear by it. So I guess she's just wanting you to comment on that.
Yeah, I mean, like I said, if there's proof for it, that's great. But so far there's not. So just like anything else, we just want to see the evidence. I'll tell you that I have a lot of patients in my clinic. I see thousands of people, and I'd say a good chunk of them have had vision therapy, and they're still in my clinic. So, maybe it works for some and not others. So yeah, if you're getting better, then that's great, but the evidence isn't there right now.
Okay, great. Well, thank you so much. We really crammed a lot into
that.
an hour. No, it was fantastic. For those of you watching, just so you know, Christian has very kindly posted the link to the brain injury guidelines. Just so you know, there's actually a healthcare practitioner version and a patient version. So you can always let your family doctors know about that. He has also posted tonight's presentation in there as well. So, and just, I guess, one final comment in terms of the questions with regard to headache and vision therapy and tinnitus and all of these things. If you look on the Canadian Concussion Centre website, we have had specific talks on each of these symptoms. So you can actually go back and take a look at those. And you may, for those of you whose questions we couldn't get to, you may be able to find the answers there. So thank you very much. Just to let you know, we have our next session on Tuesday, May 10th, and we're going to be hearing about legal legislative guideline issues with Dr. Charles Tatter and Mr. Patrick Brown. And then finally, just so you know, a short survey will be coming your way. Just takes a couple of minutes. We really appreciate any feedback that you may have for us, suggestions for future sessions and that sort of thing. So thanks so much. And Christian has also just put that in the link as well. So thanks, and have a great evening.
Thank you.
Thanks.